listening to CMDA Matters, the weekly podcast of Christian medical and dental associations. Here's your host, Dr. Mike Chupp.
Welcome back, friends, to CMDA Matters, where each week we bring you conversations with various experts and passionate champions. Well, they help us take a deep dive into the topics and the issues that matter most to Christians who want to glorify God in their healthcare professional work. Our Board of Trustees, with all 20 members in attendance, just gathered for our winter meeting this past weekend. We were hosted and inspired by the gracious leaders and staff of Frontiers USA at their U.S. headquarters there in Phoenix. For those of you listening who are not familiar with Frontiers, it's a mission devoted to inspiring transformational movements to Christ within least reached Muslim people groups, even those groups in uncharted frontiers. A bonus for the board and for me, as well as our senior CMDA national leaders, was the opportunity to fellowship with the CMDA Phoenix Local Council and our area director in Phoenix, Mr. Brian Stout, and his wife, Sharon. The best part, I have to tell you, of my job as CEO of CMDA is getting to meet so many healthcare professionals who are drawn to this movement of disciples of Jesus Christ in cities all across the U.S., including there in Phoenix. The pleasing aroma, if you will, of the great physician emanating from those saints in healthcare in Phoenix and Tempe, Arizona, it still lingers in my heart and my mind as I record this week's program. Thank you, Phoenix CMDA and Frontiers USA for making us feel right at home in the heart of the Southwest. On this week's episode, I'm joined by regular co-host Dr. Jeff Barrows for a conversation with Dr. Sharmayne Brooks, who serves as the chair of CMDA's Commission on Human Trafficking. The fight against human trafficking is a topic that has been near and dear to CMDA for over 20 years, especially to our VP of Advocacy, Dr. Barrows. I brought Jeff Barrows and Sharmayne together this week as we recognize the month of January as National Human Trafficking Prevention Month. I'd like you to listen in as we unpack some of the stats and the stories that have led to labeling this plague as modern-day slavery, and how you, friends, can get involved right where you live and/or do patient care. Well, it is January CMDA, and whether you know it or not, every January is designated Human Trafficking Awareness Month. And actually, Dr. Barrows, who's with me today in the studio, who actually launched several years ago our Fighting Human Trafficking Commission, or HTC. What year was that, Jeff?
2014, we started it up.
Okay. And subsequent to that, developed some continuing education online. The first ever CME credit that I ever got online was your course.
Oh, really? I didn't know that.
Yeah, that was the first one I ever got online of any kind, actually, was with CMDA. So every January is Fighting Human Trafficking Month and being aware of the problem. So today on CMDA Matters, we've invited the current chair of that commission that Dr. Barrows started several years ago. And she's Dr. Sharmayne Brooks. Sharmayne, on a college mission trip to Mexico, felt called to dedicate her life to full-time missions. She went on to medical school at Johns Hopkins University. She completed a master's degree in international public health and did an infectious disease fellowship focusing on tropical medicine in Lima, Peru. She's been involved in fighting human trafficking in several developing countries for over 2 decades. She actually founded an NGO that supports safe houses and awareness prevention efforts. She serves as the medical liaison for the Rio Grande Valley Anti-Trafficking Task Force. And in addition to being our own Human Trafficking Commission chair, she also serves with other ministries. that are fighting human trafficking, and it's there on the Texas-Mexico border with her husband, who's a pastor, offering free health care in an underserved community. And each year, in addition to serving there as a missionary, she travels around the world fighting human trafficking. So, Dr. Sharmayne, I've known you now for a few years and got to read your bio and just am in awe of all the things that you're involved with in protecting the vulnerable in this arena of human trafficking. Welcome to CMDA Matters.
Thank you. It's great to be here.
Could you give us a broad definition of what constitutes human trafficking?
The U.S. government has actually put forth a law, and it defines human trafficking as the use of force, fraud, or coercion to compel a person into either commercial sex acts or labor or services against his or her will. Now, there's one exception to that we always like to say when we're talking about human trafficking, and that's when it involves minors in commercial sex. So if a minor is considered human trafficking, regardless if they were forced, fraud, or coercion. So in more understandable terms, human trafficking is basically the business of stealing freedom for profit. There's different cases. Sometimes the trafficker physically forces the victim. Sometimes they trick them or defraud them. Other times they're lied to, they're threatened or manipulated into working under inhumane conditions or unacceptable conditions. We're seeing that a lot more in labor trafficking. But really, this is a multi-billion-dollar industry. Some estimates are crazy, saying there's like 25 million people around the world, and there's other studies that show even more than that.
Huge and horrific. So, Sharmayne, I'm curious, especially with your location on the Mexico border and the work you've done there. We've heard a lot about illegal immigration this past year with the election, and often the topic of human trafficking comes up. So do you think, and in your experience, has the immigration problem these past several years caused an increase in the number of trafficking victims in the U.S.? And if so, can you give us a general idea of the numbers of victims within the U.S. itself? You mentioned 20 to 25 million people across the world, but what about the U.S.? And I really am curious, and I'm sure a lot of our members are also curious, as to the situation of you and your husband there on the Texas-Mexico border. So in other words, what's happening right now where you are doing ministry on our southern border?
Yeah, that's a great question. It's relevant today. I get asked that a lot just because you do see in the news the sheer number of refugees coming in the United States that staggers your mind, blows your mind. Okay, first let me answer your first question about, so around 15,000 to 50,000. I realize that's a huge number difference if for 15 to 50. However, for those of you who are not as familiar with the human trafficking estimation numbers, it's hard because it is it's something that's done in secret. It's not like it's announced and the victims don't walk around with a sign saying, I'm a victim, please count me. It's just really hard for numbers. So you'll read different studies. But in the United States, it's estimated there are 15 to 50,000 women, children, boys that are forced into sexual or labor slavery every year. There's actually the Department of Health and Human Services. I read one study where they thought it was actually closer, like 200,000, which again just blows your mind. To give you an idea how many people are prosecuted, the year before last, we had almost 2,000 people were referred to U.S. attorneys in the U.S. And then last year, there was almost 150,000. These are ones that were, caught and sent to a court of law to be tried for. These are not the victims, but these are people that are doing the offense. So the amount of victims is definitely varied. The situation on the border, it's interesting because migration is not a new phenomenon. Most of us realize that people have been coming, refugees have been seeking political asylum or escape from poverty or danger in their home countries. They've sought a new life in our great United States for hundreds of years. Mm-hmm. So the migrants have always been vulnerable when they're coming across whatever border they're entering, just because they leave with a lot of times just the clothes on their back. They sold everything to get here, to pay someone to take them across. You've seen, there's movies about that, where you have a mule, they call it, quote unquote, that will bring them across, which costs a lot. So they're very vulnerable. A lot of them are battered emotionally and physically from their country. So that's been a problem through the years, different trafficking situations with migrants. However, the past few years, the surge in numbers has created so much chaos at the border, as you've all probably seen on the news. Those pictures are real. Someone asked me, "Are you sure those are real?" They don't look real to me. I'm like, "Oh, they're very real." We work in Mexico all the time, almost, every day. And just when you cross the border, there's just hundreds of thousands of people lined up waiting to get into America. That's not counting the ones we don't see that by night cross the Rio Grande River to get across, or pay people to sneak them across in different areas. These are just the ones we see. So this new problem, I'll use that word, is really just made the human trafficking issue, the modern day slavery numbers that we've seen in the past just skyrocket. I have a few reasons. So let me give you three that come to my mind are the top reasons. Number one, because the exorbitant number of migrants crossing our border far exceeds the capability of our Border Patrol officials. When I say officials, I mean different people who handle not just crossing of the border, but then the services that, where we house them, the centers before they are sent off to, other states. I'm in Texas, so there's different places we, house and feed them. There's a very, very, very short window of time that these officials have to figure out who these migrants are and get them out to a family member, or they have a job waiting for them. You can imagine this is a perfect storm for traffickers who know that already. Like I said, it's years this has been a problem. But now we don't have enough time to process them. We don't have personnel. They're coming through in hordes, and you're like, well, get them fed, get some kind of signature documents on them and send them out. Who's here? Is that their uncle? Okay, send them off. And we've seen it about estimated 60% of the unaccompanied minors actually end up in the hands of traffickers. That's a lot that's a lot. That increase has been the last maybe 4 or 5 years with unaccompanied minors, but also families as well. We're hearing stories of young women and men and moms and dads. I could go on and on with personal stories that we have of people that maybe got caught going across with a drug cartel member, and there's just a lot of horrors that go on that lead to trafficking situations or slavery. The other thing I feel that's really made an increase in the last maybe 10 or more years is the drug routes that have, they've been there for a while, but they've been so much more developed and sophisticated that those are used for trafficking humans now. And in years past, say 100 years ago, they were not nearly as numerous and established as they are today. So that's another reason why it's just so easy to let this human trafficking business grow. And the third thing that we're starting to pay a little more attention to in recent years is the demand side for humans has gone up. The sale of humans, the demand is there. If it wasn't there, then this wouldn't be a multi-million-dollar business.
Well, do you know, Sharmayne, is there any good data as to the most common form of human trafficking within the United States?
So the Polars Project, and there's some other good data out there that still believe and have found in their studies that the sex trafficking is still one of the highest. That includes, in hotels, pornography, massages. The residential-based commercial sex really has increased since COVID. We also are finding more labor trafficking in agriculture, especially here in the rural areas along the border. We're seeing an increase in that. Whereas other countries deal more with organ trafficking, forced marriages, we don't see as much of that here. But recent trends in the U.S. that's really important for all of us providers and our members to understand is it's a lot of vulnerable youth, like runaways from home or foster care, that are now falling prey to traffickers. And increasingly, which surprises a lot of people, is young people from every socioeconomic strata, not just those who are, been placed into foster care and are vulnerable, but the targeted online has reached all of our youth. And the traffickers are now using online means, social media, to increase victims.
What efforts are you aware of at the federal, state, or even local levels to regulate social media platforms and online marketplaces that are used to bring in these victims?
There are actually some recent data that we've been following that the U.S. has found that one of the most recently increased reported types of human trafficking is from online, like technologies like with webcams or text-based chats, phone lines, because traffickers feel more emboldened that, they don't have a physical contact, but they feel more emboldened to recruit. I don't know if that also, I do believe that's gone up a lot since COVID. Initially in 2020, we saw a small decrease in trafficking because I think everyone was trying to figure out, okay, we're all at home and there's not a lot of movement in the streets and trying to figure out what was going on. But let me tell you, very quickly, the traffickers were like, oh, this online thing's great. And as you said, it's skyrocketed now where since COVID, there's been a 22% increase in online recruitment into trafficking schemes. And a lot of those are from being recorded of sexual acts or pornography. That's been the most increase we've seen in the technology field. So what has the government done is a good question. We didn't mention before that in 2000, the government passed the Trafficking of Victims Protection Act. So that kind of laid the groundwork for the federal government to say we have to have a response to human trafficking. So since then, Congress has, tried to build on this foundation. Those who advocate for policies will know that's a big uphill battle just because a lot of the red tape, or even if it's things are passed, implementing it, especially with online, is proven to be a big fight. But there's a multi-agency approach that seems to work really well. Some states, including my state here, Texas, they have task forces backed by the government that focus on training law enforcement and other agencies. And also working with NGOs is really important in fighting human trafficking. There's like a task force, for example, to address online harassment and abuse. That's an interagency effort trying to increase prevention and response. So things like that are being done by the federal government. There's another one that we have worked with called the National Action Plan to Combat Human Trafficking. And that's, since I work with Border Patrol and my task force down here a lot, that's helping more with identifying the human trafficking and also the victims, not just the perpetrators. But it almost feels like the more we put forth, the more ways they get around it. So we have to keep encouraging ourselves and our heads up and trying to stay ahead of the game.
The technology exists to find these victims. What we lack is the people running the technology, the numbers. It's just a sheer numbers game. And as Sharmayne mentioned, it's exploded since COVID. But there's technology to track them down. It needs to be run by people, and there are not enough people to do all that. So that's a frustration and an ongoing disappointment for me, and I know a lot of people within the anti-trafficking world, which brings up a great question for you, Sharmayne, and that is, what can healthcare professionals do? Why is this an important topic then for healthcare professionals like our audience?
This is such an important topic. Can't stress it enough. We could literally talk for weeks on it. Human trafficking in general is a public healthcare crisis, just as a summary. The main thing that we try to encourage our CDM members to realize how important it is because human trafficking occurs in healthcare settings. And so therefore, the providers can play a big role in identifying and helping victims. There are some studies, which I know you're familiar with, that have found that anywhere from 70 to 88% of victims visit a healthcare facility while they're being trafficked. If you just let that number sink in, that's huge. So a huge majority of people, when they're in a trafficking situation, have passed through a healthcare facility. But the sad part is very few were being identified. Hence why we have been pushing so hard in recent years to get prevention, awareness, knowledge out there to our members, to our communities, so that we can help identify them when they do, present at our facilities. There's so many ways CMD members can make an impact in the healthcare setting. In identifying them is huge because as you become more aware of human trafficking, you also start, your next question is, okay, how do we respond? So you learn what are the signs, what are the indicators, make sure your healthcare facility has a policy in place. Then you learn different ways to interact with, if you suspect that there's a patient you have might be a victim of human trafficking, what can you do? What are some ways to get that patient apart from whoever they're with and be able to talk to you? And who do you call next? Just different things like that. And then we have found down here on the border in Texas, I know I have several other colleagues that have told me this, that you do find a lot of people, because they just crossed through our borders, they're very scared. Maybe they will admit to you in the right setting and the right conversation that they're scared and they would like to leave, but they're not ready. And if they're over 18, some of them are young, women, 23, 24. They said, no, I can't leave. I'm afraid for my family. So what healthcare providers do is you provide, you show them that you care, that you're to help them. You can give them a number to call. Please come back and see me. We do that a lot. And sometimes we'll have a patient return later and say, I'm ready now. What can I do?
Before we continue with this week's episode, here's a special announcement for you. Are you interested in short-term mission trips? Well, now is the time to start thinking about signing up for a global health outreach trip. GHO sends teams around the world to places like El Salvador, East Africa, India, the Pacific, Central Asia, Nicaragua, the Middle East, and many others. Through these trips, we disciple participants, grow national churches, share the gospel, and provide care to the poor and needy. Our teams minister in outpatient primary care medicine and dentistry, and in small and large hospitals to provide surgical services. If you're interested in using the skills and resources the Lord has entrusted to you, please visit cmda.org/GHO to learn more and find a trip that works in your schedule. If you haven't yet visited the CMDA Learning Center, then you are missing out. Our Learning Center is filled with continuing education courses to help you learn about today's bioethical issues. More than 100 hours of credits are available at no cost to CMDA members, and we're adding new courses on a regular basis. Designed to advance your knowledge in key areas of healthcare today, our educational content is a trusted source of education for thousands of healthcare professionals. And it's free for CMDA members. Get started today by visiting the Learning Center at cmda.org/learning. Let's jump right back into this week's episode.
What are the most common healthcare settings where human trafficking victims might seek medical attention? I mean, things that come to my mind immediately are the emergency room, urgent care, primary care, and so forth. But I remember from the modules that it could be just about any specialty. So, Jeff, tell our listeners about where they can find this wonderful, updated, Category 1 credit-worthy course for this.
Yeah, it's actually the course consists of, I believe it's now 11 different educational modules. All of them are certified for CME, and they're available at cmda.org/human trafficking. And they're available at no charge to all our members on our Learning Center. But I would highly recommend anybody that's interested in learning more to go there and spend the time. As I mentioned, 10 to 11 modules, so you're talking about several hours. It's not one quick setting, but by the time you get through those, you would have an excellent education on the intersection between healthcare and human trafficking, and in my mind, be close to an expert on trafficking.
Well, I remember up in Southwest Michigan, where a number of migrant workers would come and go every summer for the fruit. We were in the fruit belt. And as I took that course and then thought about the number of patients I had seen that couldn't talk to me except in Spanish, had an interpreter who was not their family member. And just like, after I took that course, I went, wow, I should have had this course earlier in my career. No question about it.
So, Sharmayne, let's finish that. What are some of the most common healthcare settings that, in your view, especially with international victims?
Yeah, I agree that some of the top ones we've seen are emergency room and urgent care, often just because the victims don't have insurance, and so their perpetrators will bring them through there just real quick to get a broken bone set, or community health centers also to have to get family planning, contraceptives, or to have an abortion. We see them there, but it can be any health setting. We say that just because there have been people in substance abuse treatment facilities where we had victims seek help there, or mental health clinics. As you can imagine, almost 100% of victims suffer with some kind of PTSD or mental health disorder from their time, in slavery. So we see it at all different kinds of medicine, even pediatric, adolescent medicine clinics. Some, especially now with the online victim increase, you'll have some kids. We have a couple cases here in the county I'm in where last year these high schoolers were going to school during the day and being trafficked at night. Apparently, they look normal during the day. They were very sleepy, but you think, oh, kids are up all night playing video games, like that. But they were sleepy, and they were kind of caught the attention of the teachers, who then did more investigation and found out that, yeah, they were being trafficked at night, almost every night. So some of those teenagers will be seen in a pediatric setting if they're under 18 or adolescent medicine to get their updated shots, or maybe because the parents are like, what's going on with you? Why are you, your teacher's reporting bad grades? There's been, unfortunately, an increase in that. So all members of our healthcare facility providers need to just be trained in what are the signs, how can the patient present. Sometimes it's not your typical looking person. You think, oh yeah, that girl, I can tell she's just looks like, a woman of, like, we kind of can think with someone who looks like a prostitute, to be honest. That's kind of what comes
That's
to
the
most of our
stereotype, yeah.
That's the stereotype, yeah. Or nowadays, when it's labor victims, you might think of a 19-year-old boy who came across who's trying to, young man, I should say, it's, trying to give money, send back home, and he's kind of with his head down, doesn't speak the language, and kind of beat up. Yes, absolutely, that does present. But there's other presentations that we're seeing that are going unnoticed.
I want to add one or emphasize one other setting, and this will please my colleague, Dr. Bill Griffin, and that is the dental office.
Yes.
A lot of these victims will have dental trauma that will then bring them into the dentist's office. And I would say to any dentist that is listening, and hopefully many of our dental members will be, that if they see trauma, dental trauma, and there's a few unusual things associated with that patient, that they think about human trafficking.
I agree with that completely. One thing that we try to help change our thinking into, think if you were, you bought this boy or this girl and you were using them for your profit. Either they're gaining money every night in the sex trade, or they're working inhumane hours every day for you and saving you money. You want to protect your profit. So they will absolutely try to get their teeth fixed, or make sure that their bones are set, or that they've been feeling bad and vomiting, and so they will try to make sure that this commodity they have is set. Well, we also have in the some people getting plastic surgery. We've had some plastic surgeons have come through. That's kind of high end, but it does happen and it does occur. So just thinking about that, where you could present with any of your problems that might occur while being trafficked, that's going to be a broad spectrum of healthcare providers that are going to be encountering these victims.
Could you go over, both of you, the indicators that might lead us as healthcare professionals to suspect? We've been dancing around it. You've talked about some things, including dental presentations, that would lead us to suspect a patient is actually a victim of human trafficking. Let's let ladies go first, and then Jeff follow up.
Absolutely.
Sharmayne, go ahead.
So one of the big indicators that we often see to this day is still a big hesitation when a patient presents, and their hesitation to speak, to look you in the eye. Often they seem kind of shy or scared. And a lot of those reasons are because they are actually shy or scared, and their situation is shameful. They're worried about being in public, and they have many times a person who is answering questions for them. They say, oh, this is my niece, this is my nephew, this is just a friend of mine that I came in with, this is my daughter. And they answer the questions. They don't speak the language, so I'm going to answer for them. They speak Spanish or French, and I know how to talk to them, and you guys don't have translators, so let me answer all these for you. And if you're not aware that that's a huge indicator, you think, especially as we've been talking about the migrant situation, you're like, well, yeah, there's so many migrants, and I don't speak that language, and let me just let this person interpret. Great, I don't have to use Google Translate. We've have a lot of our providers here that have told me stories in the last couple of years that they ended up finding out later that wasn't an aunt or an uncle or a nephew. That was a person that was a victim, and they were being brought in by their perpetrator. So the patient is very scared to talk and lets the other person talk. That's a huge one. So if they're being controlled by somebody else, if they're seeming they don't make eye contact with you, number one red flag. Obviously, we have all been trained in domestic violence and child abuse, and we know that's also a red flag there. It's a red flag for abuse. With the human trafficking one, it adds in the translator's a big deal. And if someone just demands to answer all their questions, that's a red flag. A lot of times, if you do get the patient by themselves, which takes sometimes a little work, but you do it, you often can say, hey, I have to do this exam. You're going to have to step outside. And more likely than not, the perpetrator's like, oh, I know I'm going to stay right here. I have to stay with them. You're like, I'm sorry, sir or ma'am. This is part of the exam that's private, and I have to talk to them. So you get the patient aside, and sometimes they will express concern, like they're afraid for their safety or that they don't want to talk about it because they know they're going to get in trouble. And those are all red flags. Like, why don't you want to talk about it? This is a safe place. But no. And they get that, the deer in the headlight look of that wild-eyed, no, please, just fix me and let me go. Those are all big red flags, indicators for human trafficking, as well as you can also see how they're dressed. Obviously, if there's bruises or lacerations that don't really fit with the story, the changing story. We have in our women's health centers, when you have a lot of people coming in for pregnancy tests or abortions, our tendency as humans, I think, is we tend to think, oh, girls just, mess around being promiscuous or they're, prostituting themselves. You just kind of think that way and not ever stop and think, wait a minute, maybe they don't want to be doing this. Sometimes they have tattoos that you can, again, I show in some of our presentations what we all do of the ones that they were branded, and you just think it's a woman of the night kind of thing, and she's just wild. And a lot of those times, nope, they did not choose that tattoo to be put on them. It's a brand. Those are just some of the things, as well as substance abuse and STIs, if there's frequent numbers. In addition to these other things, just really raise your suspicion.
Yeah, I would agree with everything, Sharmayne. I think to be helpful to our listeners, I've always kind of put it into three major categories that you've hit all three. The first is indicators of control. The patient is being controlled by someone else, and you went through several of those. The second one is this very strange historical or what I called strange red flags, and you've hit on a couple of those, just the way the patient's acting. Sometimes the girls don't know what city they're in, if they're in an ER because they get moved around so much, or they may not have an address. That's really weird, that type of thing. And then the third category is the physical indicators that you mentioned, signs of trauma, the branding, the tattoos, that type of thing. So those three things, indicators of control, just strange red flags, and physical indicators is a good way to remember it.
So, Jeff, thank you. Thanks to both of you. A very exhaustive coverage. But then what's next? I mean, what do you tell? I realize they need to go online and do some of these modules.
Module 4.
Module 4.
Yes.
But basically,
That's a good one.
Can you do stuff right now? I mean, can we do to protect this victim?
That's a great question, Mike, and I'm curious as to Sharmayne's answer. I will start by saying that when I started talking about this to medical audiences, I would give them certain ideas of things to do, but I kind of changed over time because if you don't have adequate preparations ahead of time, and that includes critically an educated law enforcement official that understands trafficking, and other things like the way to get the trafficker away from the victim. If you don't have those in place ahead of time, you have a risk of causing more harm than good. And so I kind of changed in the last several years of just saying to hospitals, just get their license plate number, give their information to law enforcement, and treat their medical problem. Let them go and follow up with law enforcement. And you're not going to be sure whether they're victims of trafficking, but you're going to have your suspicions, and so you turn it over to law enforcement. That's where I am.
So you have someone from the staff sneak out to the parking lot and grab a license plate.
Literally,
number.
yes, you do. And that's I've been told more than one time by law enforcement that is the most helpful piece of information. Because phone numbers can be, they can be faked and change all the time. But license plates, cars can be stolen, yeah, but they can usually run them down. And but that's my approach. Sharmayne, I don't know what you're saying.
Oh, I agree completely with what you said. That we've had that too, where just being helpful like that, having a helpful eye, we all feel like I wish we could do so much more. But even cooperating with law enforcement by saying, hey, here's a license plate, here's a description of this patient I had and this person they were with, I'm suspicious. They are so thankful. We continuing on your you were talking about earlier, Jeff, that people are not trained. That's one of our big goals, I guess, as for the commission and just as in our different task force across the U.S. is to promote awareness and activity so much among those in law enforcement, because I've heard so many stories of different states who maybe haven't had developed their protocols, aren't sure what to look for. Again, just think we picked up this prostitute and now we threw her in jail for a couple of days and now she's back out, or we threw her back across the border because they were illegal, and not realizing this is a traffic. So the traffickers just keep on going until we get training. And there's been such a great increase in that. It's definitely improved. We have way more task forces than we did 10 years ago across the U.S. and trainings, but there's still so much lack. And that's a big one. If you're listening to the podcast and you're thinking, I don't even know if, we have a whole lot of victims in my area, or if my police force is aware of this and my hospitals, that's a great place to start. Just researching finding out, talking to people, talk to your friends who might be on the police force and ask them, do you have a human trafficking department down here? Because we're so close to the border. We almost all of our counties have one. And we encourage people to check on that and see if you can get that established. There's lots of online organizations that will provide you free resources to teach law enforcement or lawyers or teachers or social workers. There's lots of different areas you can get involved in. Churches, NGOs have a huge place, especially in areas where the law enforcement aren't sure what to do. If they know a church member is involved with helping with the homeless or helping with runaways, they'll often call and say, hey, can you help us? We're not sure what to do with this. We've had that happen here, actually, believe it or not. We don't have the greatest setup for shelters here, which is something that they've been working on. But they will call a church, an NGO, and say, can you house this victim? And if you have the knowledge and you've been trained and you're willing to jump in, there's just a lot we can do to keep, I want to say, fighting, because it's a big fight, but encouraging everyone that they do have a place.
Well, I'm reminded there are many Old Testament scriptures that talk about the populations that are really most vulnerable to trafficking, but one of my favorites is Zechariah 7, verses 9 and 10. And it says, "This is what the Lord Almighty says, administer true justice, show mercy and compassion to one another. Do not oppress the widow or the fatherless, the alien or the poor." And those are the four different populations that are most vulnerable to trafficking. So, Sharmayne, again, thank you for your work and the work of the Commission to keep this alive within CMDA and hopefully to spread not only the good news of Jesus Christ, but to be salt and light in this dark area.
Amen. Amen.
I love that verse. That's awesome. Thank you so much.
Well, I don't know about you, but I was just a bit overwhelmed by the facts and figures that Dr. Brooks shared with us near the beginning of our conversation. Every time I hear stats like these, I'm disturbed just knowing that so many of God's precious children are being imprisoned within the horrors of human trafficking. At the same time, those statistics are a pertinent call to action for all of us. We as Christians in healthcare, we got to be diligent to talk more about this issue and to reach out where appropriate to law enforcement and to our friends and our colleagues about recognizing this issue, which might just be happening right in front of us as healthcare professionals. Because we are called to protect the vulnerable, we should make every effort to be diligent and watchful. And as Dr. Barrows said, referencing Zechariah 7, administer true justice, showing mercy and compassion. And that includes the aliens and the orphans among us, which right now in 2025 is just right front and center for those of us in the U.S. CMDA has some great resources available to help you step into this arena and proactively start learning now, so you can recognize the signs of human trafficking, especially when the potential victim is face to face with you in the exam room and or in the hospital. the first place to visit is our CMDA Learning Center, which we have provided as an exclusive benefit for CMDA members. It offers you free continuing education credits. In the Learning Center, you're going to find a 12-module series developed by CMDA's Commission on Human Trafficking. This course gives you an introduction to human trafficking here in the U.S. It also explains how you can spot the signs of patients who are being trafficked. It will help you discern how to both help and treat these patients and a whole lot more. To access the course, just visit cmda.org/learning. Well, it gives me great pride and pleasure to share with you that my co-host for today, Dr. Jeff Barrows, actually dedicated 15 years of his career after a very successful and busy OBGYN practice to this issue of human trafficking within the intersection of trafficking and healthcare, as well as the rehab of survivors of child sex trafficking. He's also trained healthcare professionals on how to recognize and assist victims of trafficking within healthcare. He took the time and actually wrote a novel that deals with the spiritual warfare involved in human trafficking. And we've got it available for you in the online CMDA bookstore. It's entitled Finding Freedom. So just visit cmda.org/bookstore to get your copy today. By the way, if you want to hear some of our previous conversations on CMDA Matters about this topic of human trafficking, and we've had several, we've included some links in our show notes for you today. Next week, Dr. Jeff Barrows and I will be back to bring you a remarkable, life-affirming discussion with a board-certified OBGYN who was a practicing abortionist straight out of her training. You'll get to hear how God changed. He transformed her heart and turned her from her own personal, distorted attitude about abortion to repent and gain a fresh understanding of truth and the sacredness of human life. Join us as we talk candidly with Dr. Catherine Wheeler about her past and her change of heart to fight abortion rights in the state of Colorado and protect the preborn. In closing, I want to remind you of our conversation today with Dr. Sharmayne Brooks as she talked about how healthcare professionals, well, we sometimes find out too late that someone was being trafficked right in our clinic, and that individual was being controlled. She said, quote, "Well, that wasn't an aunt or an uncle or a nephew. That was a patient who was a victim," close quote. Friends, how many patients have we seen in our clinics and in our emergency rooms, in our offices, who are actually victims of human trafficking? As Christians in healthcare who are seeking to protect the vulnerable, we need to be prepared, frankly, to recognize the red flags that come into our spheres of influence, because we have the God-given skills and the God-given ability to make a difference for our patients as well as victims of human trafficking. And as we do so, we will be bringing the hope and healing of Jesus Christ to the world. That's what matters to CMDA, friends, and CMDA matters. We'll see you next week, God willing. And I don't think I've taken the time this year so far, 2025, to thank our production crew for CMDA Matters, starting with Mandy Moran, our producer who sets up all these interviews, Rusty Sluter, our sound technician, and our wonderful announcement maker, Mrs. Jamie Majeski. Thanks, guys. Appreciate you big time.
Thanks for listening to CMDA Matters. If you would like to suggest a future guest or share a comment with us, please email cmdamatters@cmda.org. And if you like the podcast, be sure to give us a 5-star rating and share it on your favorite social media platform. This podcast has been a production of Christian Medical and Dental Associations. The opinions expressed by guests on this podcast are not necessarily endorsed by Christian medical and dental associations. CMDA is a nonpartisan organization that does not endorse political parties or candidates for public office. The views expressed on this podcast reflect judgments regarding principles and values held by CMDA and its members and are not intended to imply endorsement of any political party or candidate.